Hí banan má ceist leis an vaccine in COVID, níos cirta rá in áire na vaccine in COVID. Agus go háirid an sláíocht chúisih atá tuga ag an rialtas don na cólachtaí cogasíochta, agus ceangailte lei sin an bearna mhór atá an ó híomh córas cúisih maidir le na daoine a bheits ag dailá le dochar ó na vaccine sin. Kibbe biog is atá an dram sin. Taoiseach, my question relates to the indemnity that has been given to the companies in relation to the vaccine or vaccines, and integral tied in with that is the absence of any compensation scheme, despite the Meanin report, which I'll come back to, which doesn't appear to have been published. Now, if I could save you time in your response, I believe that vaccines are an essential part, or an essential tool in our fight against COVID. So if you could avoid telling me how important it is, and maybe díruas ja an ceist. And the question is, what are the details of the indemnity given to the companies, and what about a proper system of compensation for the group of people who may suffer or will suffer from the vaccines? Now, I ask that because we need trust in the system, and we get that trust to encourage people to come forward and have maximum take-up based on transparency and facts. Now, your comments in the Dáil in relation to one of the TDs that asked you about this was to get real. We're dealing with an unprecedented situation. Your comments were quoted by Professor Luke O'Neill in The Independent, and he went on to compare the vaccine to the atom bomb. In the context of today's discussion, words that were totally unacceptable, comparing the vaccine to the atom bomb in our fight against COVID. I quote, unquote, there were the words he used. And he talked about the marvellous advance in science, which it is, absolutely, and the quick progress made, but absolutely no acknowledgement of the public funds that have gone into the development of these vaccines through the Commission on our behalf, and absolutely no information to TDs in relation to the amount of money gone in to the development of it, and in relation to the indemnity. And then tied in with that, what will happen for the small group of people who will suffer from the vaccines, as happened in the past, from the swine flu vaccine, and indeed the up-to-date figures in relation to that are 123 claims, 113 live ones, and fighting every inch of the way. Let me add that the recent case that settled Blackwell, they were at pains to point out that they weren't anti-vaccine, they weren't anti-science, but had they been given full information at the time, they would not have administered or allowed the swine flu vaccination to be given to their child. So, two specific questions. What are the details of the indemnity given, and what about the independent compensation system?
Thank you very much, Deputy.
First of all, the government actually considered the Meanin report today, and the law of tort around medical negligence generally. And there's a recommendation there to pursue a vaccine compensation scheme with the Minister for which the Minister for Health and Justice are pursuing and working on developing and producing such a scheme. In relation to the indemnity, the content of the advance purchase agreements, including with regard to liability and indemnity, are negotiated with vaccine suppliers by the European Union Commission and its negotiating team, acting on behalf of Member States. Member States may decide to opt in, opt out, but do not have scope to recast the provisions of any EPA. The indemnity clauses in the advance purchase agreements relating to indemnification and liability are open-ended, requiring Member States to provide legal support, costs and payment of claims arising from any damages associated with administration of the vaccine. It's not possible, obviously, to quantify the extent of any claims that may arise, but the balance here is we do need access to a vaccine. There has to be some element of risk attached to that. But when you consider the trillions that have been spent so far around the world in combating the worst effects of COVID-19, both health effects, which has resulted in the deaths of many, many people worldwide, and over 3,000 people on this island, and illnesses that people get, there's a need in order to protect the overall population, for a vaccine to deal, or a series of vaccines to deal with COVID-19. We did this for smallpox, the human race did. It did it for polio. It did it for TB, with tremendous outcomes and tremendous results. And the State Claims Agency has been consulted and agrees that it would be appropriate for responsibility for claims management in relation to these agreements as well, and is on board with the decision that has been taken in relation to doing this. And remember, this has been an extraordinary development. I can recall in my own time as Minister for Health when there was no coordination across Europe during the SARS epidemic, and when there was no chance or opportunity for pharmaceuticals producing anything collectively or in partnership with governments. And it would have been every member state for themselves, and the smaller member states would have lost out hugely. I think it's a very good initiative. I think the European Union Commission deserves credit for coordinating this, and it will enable the European Commission, for example, not just to make sure that there's enough and a surplus of vaccines for everyone living within the European Union, every citizen of the European Union. It'll also help to look after states who will not be in a position to get the vaccine, in the Western Balkans, or indeed in the Third World, and states that will not have the incomes necessary. Europe is committed to helping those states as well procure the vaccine. And I think it's because of working collectively we are stronger.
Details of the indemnity. Is it a blank cheque? What are the conditions in that indemnity? Has there been a risk assessment in relation to it? I perfectly understand there's a balance of risks in relation to the damage done by COVID and the damage done by vaccines. I'm specifically asking you, where was that decision taken? Was it taken at Cabinet? Based on what? What was the risk assessment? We should have a full discussion of that in the Dáil. If you want full trust in the system, if you want to maximise the number of people who are going to take the vaccine, you must give full and transparent information. That hasn't happened. We're reliant on jigsaw pieces from newspapers that tell us this is a standard procedure, which is not accurate. Telling us that so many companies have signed up, we don't know how many. So I, as a TD, am looking at a distorted jigsaw picture of an indemnity and a complete lack of action in relation to an independent compensation system. You mentioned Meehan. Meehan was commissioned back in 2018. The report has been finalised for a very long time. A specific terms of reference was in relation to a scheme in relation to the damage from vaccines. Where is it, Taoiseach? Sorry, I would expect a proactive approach in relation to the indemnity and in relation to the compensation scheme.
Deputy.
Thank you.
Taoiseach.
First of all, I've just said that we considered Meehan today and adopted the Meehan report and are working on a compensatory scheme, a vaccine compensation scheme. I said that. And I said also to you that the advanced purchase agreements, which the European Commission entered into on behalf of member states, and in relation to the indemnifications and liabilities, they're open-ended. They're open-ended. And require member states to provide legal support, costs and payments of claims arising from any damages associated with administration of the vaccine. And remember, we're trying to get vaccines to people. And I think what's been achieved, there's two ways of looking at this. We can always undermine and seek to pick holes in it, or say this is far better than was ever attempted before in the histories of states working together. Because up to now, it would have been the pharmaceuticals would have been producing them on their own and charging highest price to the highest bidder. That's what you would have had if you didn't have a coordinated European advanced purchasing agreement taken up by the Commission on behalf of the member states. Sometimes it does work too, Deputy, to maybe acknowledge a bit of that. And no, I know you want to say what I'm not supposed to say, as if I'm not allowed to say these things, but please, no, I just have to say that. And in relation to the 6 advanced purchase agreements. Well, I said this before, there's Moderna, AstraZeneca, Janssen, BioNTech, Pfizer, Sanofi Pasteur and CureVac. Those are the ones that the Commission have entered in. There may be a 7th as well that will come along. But the balances have to, and decisions have to be taken here. What was the prioritisation? to have a safe vaccine produced and developed that we can administer to the population to try and get population herd immunity from a COVID-19 that has absolutely destroyed lives and upended our societies across the world. That's the agenda. The motivation is as clear and honest, as principled as that. There is no underhand motivation here.
Taoiseach.
And the entire campaign will be open and transparent and based on informed consent for people who want to take the vaccine.
Thank you. That concludes leaders.